Assalamu alaikum wa rahmatullah. Thank you, Mr. Chairman. Thank you, Mr. Co-Chairman. Thank you all for your attendance. My study is about agreement between direct smear microscopy and gene expert MTB Rifadin in diagnosis of pulmonary tuberculosis among patients attending consultative clinic in Kirkuk. And the third is a PhD professor, Dr. Muhammad Abdulaziz. As it has been mentioned along the 2 days, that tuberculosis is one of the most deadliest diseases worldwide. About 2 billion people carry latent TB in the world, and more than 9 million will become ill, and about 3 million will die. Poor health system, limited lab capacity for case detection, treatment barriers, and complications make tuberculosis a major challenge filling the public health program. Detection of Mycobacterium tuberculosis species is mainly detected by Zell-Nelson stain, which employs acid-fast staining technique, and most of the audience know the technique, so I will not go to detail this technique. The expert MTB Rifadin assay is a fully automated molecular diagnostic test for TB disease. Developed in partnership with CFIDE, the Foundation for Innovation New Diagnostics, the University of Medicine and Dentistry of New Jersey, and the International Institute of Health. It can detect rifampicin resistance from sputum specimen in less than 2 hours and minimizes the staph manipulation and biosafety risk. The objectives of this study is, first, to show the agreement of conventional and new methods in detecting Mycobacterium in sputum and other body fluids. Second, to detect rifampicin resistance among smear-positive cases. Patients and methods. A cross-sectional study was recruited. 72 patients presented to chest and respiratory disease clinic in Kirkuk for the period between 4th of September to the 4th of February 2014. Sputum samples were obtained from each patient for direct smear microscopy and gene expert for detection of Mycobacterium tuberculosis. Then the agreement in results of both investigations was assessed. Regarding sputum sampling, each TB suspect was requested to submit 2 sputum specimens, one for the conventional smear plus the expert, and the second for the conventional smear alone. When the results of expert was positive, the rifampicin-sensitive patients were registered at CAT1 or CAT2 according to their drug history. If the specimen proved to be Rifadin resistant, then it was subjected to culture and drug sensitivity test, DST. Results. Out of total of 72 samples, 35 male and 37 females tested for the presence of Mycobacterium tuberculosis. 46 were sputum and 8 were for body fluids. Table 1 shows the distribution of positive cases in AFP and PCR according to gender, and as it is obvious that PCR detected double number of AFP. Table 2, which is the core of the study, shows that gene expert, as we mentioned before, has diagnosed double the number of direct AFP, as we had 4 cases of AFP positive, while in gene it was 9. Table 3 shows the number of and the percentage of Rifadin-resistant cases according to gender, and as it is obvious that male had higher rate than female. Discussion. WHO had started the largest rollout of gene expert as detecting TB rapidly and identifying drug resistance on the spot as an essential step to improve care of the infected people and avoid the transmission in the community. Table 1 shows the distribution of confirmed TB cases according to gender. It's almost identical. It may be related to sample size, and I will say that our sample size is small because we have started the test at the late 2013. The higher percent of positive cases detected by PCR is disagreed with the WHO report, as male reporting much higher rate than female. In a study conducted in Ventanilla in 2005 showed that tuberculosis globally kills more women than any other single infectious disease. In a survey conducted in Malaysia and prisons, it was documented that a single GeneXpert assay proved to get 53% sensitivity and 100% specificity. Detection of drug resistance is in comparing the conventional AFV and new PCR showed that male got higher resistance than female, although the number of cases, as we said, was small, because tuberculosis on its own is a rare disease, and among the all notified cases, resistance occupies 3% of the TB cases. It's concluded that GeneXpert is superior to direct AFV in detecting mycobacterium tuberculosis by time and detecting resistance in less than 2 hours. I have done this SWOT analysis for the study. The strength: first, the presence of trained personnel in the clinic, availability of rapid detecting of resistance to rifadin, availability of equipments with 100% specificity. The weakness was the lack of available culture media in the clinic at the time of the study. The opportunity, of course, the continuously available material for PCR will increase the CDR, and the threat is the unstable electricity. Recommendations: first, expansion of GeneXpert to district levels and analyzing the trend of drug resistance in each governorate to detect the risk factors in developing the DR all over the country. Thank you very much.
Knowledge, attitude, and practice of the committee members, TB patients, and healthcare providers towards tuberculosis in Iraq. This study was conducted in 2012. I'll pass the introduction. This study specific objectives are to assess the knowledge, attitudes, and practice of physicians, both NTP and non-NTP, in public health facilities, and of community members and patients towards tuberculosis and its management. Methods. This is a cross-sectional study that used to implement the CAP survey in 15 governorates. So we can say this is a national study. 15 governorates in Iraq over the period 2011 to 2012. The 3 governors of the Kurdistan region were excluded because already a similar study was conducted earlier there. The survey participants were committee members, TB patients, and physicians. During a 1-month period, candidates were interviewed by trained study personnel using pre-tested standardized questionnaire forms. Proportional probability sampling technique was used to determine the clusters and cluster sizes for each study group of TB patients, committee members, and physicians. Scores were analyzed using SPSS, a statistical package, and the test was an ANOVA test. Main surveying results were: for committee members, the number of respondents were 1,972. 30% of participants, 30% of the committee members, heard about the National Tuberculosis Program. 73% believe that tuberculosis is a recoverable disease. 87% said that tuberculosis patients should seek help from primary health care centers for TB clinics, which is a a good percent. 80% avoid or try to avoid TB patients. This is